Smile designing. Dental midline. Dental midline should be collinear with facial midline, vertical contact interference between the two centrals, perpendicular to the interpupillary line and parallel to facial midline. As long as the midline is parallel with the long axis of the face, midline discrepancies up to 4 mm is not considered unaesthetic, but candid midlines aren't considered aesthetic. Incisional lens, age position. Most important determinant in smile correction, as one said, it serves as a reference point for establishing the proper tooth contours and gingival levels. Degree of tooth display, phonetics reference, patient's input. Degree of tooth display. A normal tooth display at rest is about 2.5 to 3 mm. If the overall display of teeth is less than 2.5 mm, then orthodontic extrusion or orthodontic surgery has to be considered. If teeth with both angles fracture, this can be served as a guide in deciding placement of incisal edge. But this is only true for young individuals. Phonetics and references. Phonetics play a in part in determining maxillary central incisor design and position. F and V sounds are used to determine the tilt of incisal third of the maxillary central incisors and their length. E, a incisal edge should be halfway between the upper and lower lip. Golden proportion, first mentioned by Lombardi and later developed by Levin. When viewed from the facial, the width of each of the anterior is 60% of the width of the adjacent tooth. 1 is to 6 is to 1 is to 0.6. Central incisor is 62% wider than the lateral incisor, which in turn is 62% wider than the visible portion of the canine, which is the mesial half which viewed from the front.